Good morning, beautiful stats people. My name is Kara, and my lovely two other partners in this project were Cheyenne and Maxine. And today we're going to be presenting our research when examining the relationship of shoulder injuries and posture in overhead athletes. So we stumbled across this topic after realizing the common denominator between the three of us was poor posture in our athletes. Both Max and myself work with volleyball athletes, and from this, we noticed a lot of our athletes coming into clinic with chronic shoulder pain. They also had poor posture. Even my clinic supervisor sent out a mass email to remind students to practice good posture when sitting for online classes all day. This is because the clinic as a whole was tired of treating the same chronic neck and shoulder issues and felt that it was related due to poor posture. From this information, we decided to explore the relationship using our critical appraisal.
So we'll start off with a brief definition of an overhead athlete, which encompasses any sport involving the repetitive use of the shoulder with the arm position above 90 degrees. These sports are also involved in high force glenohumeral flexion from this overhead position, and we can see this in sports such as volleyball, tennis, baseball, with the throwing or hitting movement, as well as with the propulsive movements used in swimming strokes. This can put athletes at a higher risk for overuse injuries of the shoulder. Because of the chronic load and repetitive rotational forces placed on the shoulder, overhead athletes are more susceptible to a variety of shoulder-related injuries. These include mainly chronic issues such as impingement or rotator cuff pathologies. However, altered biomechanics and musculature imbalances can also increase the risk of acute shoulder injuries. Taking a closer look at the biomechanics brings up the question of how posture is related to the shoulder injury risk. Athletes tend to have poor upper body alignment, especially seen with rounded shoulders and forward head posture. Due to the demands of their sports, we tend to see hypertrophy of the anterior shoulder muscles, such as the pectorals, and weakness in the posterior muscles, such as the rhomboids and lower traps. This muscular imbalance pulls the scapula into a less functional position and can cause issues in the glenohumeral joint during the dynamic movements of an overhead sport. While there are many studies highlighting the relationship between overhead athletes and shoulder injuries, there's limited evidence on the effectiveness of postural rehabilitation in mitigating and preventing shoulder injuries, with the goal of reestablishing range of motion and dynamic stability in the shoulder.
We decided to explore the questions of whether a postural correction program can have any impact on the prevention or improvement of shoulder injuries in overhead athletes. Using three trusted databases, we broke down our question into three main parts: shoulder injuries and the common specific names of them, overhead athletes and their related sports, as well as posture, which was broken down into postural control and rehabilitation. Initially, we wanted to focus on just volleyball athletes, but found it was much too limited to find relevant research. Our group as a whole wanted to see if this relationship expanded beyond the world of volleyball. By using overhead athletes, our search was narrowed down significantly, leading to 94 records identified across the databases. From that, 32 articles were found to be available in full and in English. Using our exclusion criteria, 6 articles were chosen to examine.
3 of the studies we looked at had a positive conclusion regarding the relationship between postural exercises and shoulder injuries. These included a controlled laboratory study, a randomized clinical trial, and a case study. 2 of these studies implemented a muscle-based program for the shoulder complex for 6 to 8 weeks. Their outcome measures were shoulder function in various positions. The other study focused on the effects of cervical range of motion and postural correction within 24 hours. It measured shoulder pain and strength. Overall, these studies found that these interventions were successful at increasing posture and decreasing symptoms. The other 3 studies found neutral results. These included a randomized control trial, retrospective cohort study, and a cross-sectional cohort. One study implemented a 6-week strengthening program for the shoulder complex, which resulted in no significant differences between the groups. However, it did have positive trends. The other studies consisted of assessments of the shoulder complex between those who have had shoulder injuries or currently have a shoulder injury and those who do not have any sort of a shoulder history. Again, in the one study, there was no statistically significant differences in core control or postural stability between groups. The other found that active range of motion and strength was similar despite a history of shoulder injuries, with the exception that those without a history had a greater reach compared to those with a history of shoulder injuries. Due to the lack of evidence and strength of evidence, we cannot make a definitive statement about the relationship between posture and shoulder injuries. However, we did not find any studies indicating that there is absolutely no connection between the two, and even the neutral studies were showing positive trends. In order to make a recommendation of integration into practice, more studies need to be conducted to truly make a reliable and valid statement.
After examining these articles using the quality assessment tool, as well as CEBM for the case study, only one was found to have a global ranking of strong. The rest were moderate or weak due to the design of the study and the fact that some researchers failed to explicitly state the potential confounders and what they may have done to mitigate the impact they had. With this in mind, it is important to do future research to enhance the level of evidence and determine clinical relevance for future application. Based on the current level of evidence, more expansive research should be done to determine clinical relevance. With that being said, there was no harmful evidence when it comes to applying posture to shoulder injury and dysfunction. This is a positive sign to continue the research of the relationship between shoulder injuries and posture. Clinically, there is a significant amount of anecdotal evidence, but to strengthen this, researchers should focus on obtaining a higher level of appraisal. Once more robust research is available, meta-analyses should be done to eventually inform and potentially alter the current best practice.
Thanks for listening.